Is there like at all an amount of alcohol that's like a safe amount of alcohol? Everyone wants to know this.
It's funny you asked that. So a few months ago, the recent US Surgeon General had brought up the idea of putting warning labels, an extra step to help caution people from drinking alcohol in all alcoholic bottles, talking about the potential carcinogenic risk. And so we know that at least seven types of cancers are associated with drinking alcohol. And so the big question is, well, what are the guidelines right now? Right now, the guidelines currently state that for men, up to 2 drinks of alcoholic beverages per day, and for women, up to 1. Although some studies do talk about that even less than 1 drink per day can actually associate with cancer risk, with increasing your risk.
Welcome to Glowlab. We're going to have a lot of fun and learn a lot together. A couple of years ago, I hosted a dinner for my brand Tiutan, and of course, I invited a couple of doctors to join me to learn more about the brand. Most of the time, I invite dermatologists, but this one night in particular, I happened to invite today's guest, who is a board-certified internal medicine physician. His name is Dr. Tim Tiutan. He is also known as Dr. Tim Online, and I've really loved watching his platform grow because he educates so much on how to prevent cancer, foods that you should be eating, and really just helps to even the playing field when it comes to medical information on social media. So I'm really excited about this conversation because we are going to talk about cancer prevention. Can you kind of give us a little bit of your background?
So I guess first and foremost, I wear several hats. First, I am an oncology hospitalist, which is basically a physician who takes care of the medical issues of hospitalized cancer patients. So I work in a cancer center here in New York City, but I'm also an assistant professor full-time, where I teach medical students, residents, and nurse practitioners, physician assistants, and really hone in on that educational platform in my professional world. And in my third kind of last bucket would be my social media platform. I really do care a lot about even the playing field in regards to access to good health information in social media. But then I guess in regards to my bio, I talked a lot about my role as an official spokesperson for the American Cancer Society, where I do a lot of advocacy and cancer prevention. I work in the WHO Fighties Network, which is basically a community of creators, content creators throughout the world who combat misinformation all over. And yeah, I also contribute in CBS News. So do a lot of different things.
I love it. I mean, look at this face also. Like you are so cute, so handsome, so of course.
You're too kind.
And by the way, I found him because he used a Naturium product. And I was like, wait, who is this amazing person?
I was a diehard fan.
I
have been. I've been using, I think it was the vitamin C serum I'd used for years.
Yeah.
Way before even I started social media.
I love it. And then we got dinner. And the minute I started talking to you, I was just like blown away by how easy you give information about, especially about cancer prevention. So I guess for this conversation, first off, I think most people, I'm sure you see this, they come in to fight cancer that they're already dealing with, but we can be preventing it, right?
Not enough people talk about this, Susan, but approximately 40% of US men and women will develop cancer in their lifetime. Let that sink in. I mean, that's nearly 40%. It's something like 38.7%. That's astounding.
Yeah.
And I joke about it, but not really. But one of my biggest goals in life is to have people not see me in the hospital.
Yep.
Right? Because by then you would have already been diagnosed with cancer and then also had some form of medical illness to land you there.
Yeah.
And so we really need to figure out, and there's a lot of growing research and evidence on what exactly is causing a lot of these cancers that are now presenting at much younger ages than ever before. Colon cancer has been in the news a lot lately because of that reason. What I try to do is really put it back to all of us and figure out what is it that I can do? What can I control to lower my overall cancer risk? Because a lot of people say online, genetics plays a huge role anyways. So why not just eat and do whatever you want because you're going to get cancer anyways?
Right.
Well, a lot of cancers aren't due to genetics. Actually, there was a study that was published recently that showed that 40% of cancers have preventable risk factors.
40% of them. Which ones would these be, like off the top of your head?
Like lung cancer, colon cancer, the cancers that are mostly associated with the preventable risk factors, meaning alcohol intake, tobacco, so smoking, and excessive weight gain are the 3 most common preventable risk factors associated with cancer.
That makes sense. You know, I've actually been meaning to ask someone like you, like a doctor, about this, but with the uprise in smoking pot, marijuana, right? I mean, I know a lot of people are using, edibles and stuff now too, but because it's becoming legal in more and more places, does that also contribute to lung cancer?
That's a good question. It's a growing body of evidence because for years, of course, it was a very controlled substance. And so the lack of research, we haven't really been able to do it. And so, yes, there are studies that are now suggesting that there is a potential link, although not as strong as, at least at this point in time, in regards to cancer risk with tobacco and smoking.
Okay. Yeah. So it's really the function of tobacco, nicotine, that kind of thing.
Yeah. Yeah. And so we think about vaping, e-cigarettes. There is potential risk associated with it. Same thing. There's just more evidence will come out, I'm sure, over time.
Right. Because, I mean, vaping it was presented when it first came out as safer than smoking, right? But then more and more younger people started doing it. I mean, I see it all the time. I see people you'll just be sitting there and you don't even realize that somebody vapes and then they pull something out and they just kind of take a quick hit off of it and they put it back in their pocket. And it's crazy to me to see how many people are actually doing that.
Yeah, because there's lung injury. There's not even only cancer. There's lung injury. There are a lot of other chronic medical conditions that could stem from e-cigarettes, from vaping, et cetera, that we just haven't tapped yet.
When it comes to tobacco, when you're using chewable tobacco, for instance, or maybe nicotine patches and stuff, do those play any part, or it really has to be the function of smoking it?
I mean, I guess there are different types of cancer associated with how you consume tobacco. For example, with chewing tobacco, that, of course, oral cancers, and then inhaling, of course, lung cancer. Nicotine patches are typically used to help prevent smoking.
Yeah.
And so they're used in a medical sense.
Okay, so better.
Yeah.
Better.
Yeah.
All right. So cutting out the alcohol. Is there at all an amount of alcohol that's a safe amount of alcohol? Everyone wants to know this.
It's funny you asked that. So a few months ago, the recent U.S. Surgeon General had brought up the idea of putting warning labels, an extra step to help caution people from drinking alcohol in all alcoholic bottles, talking about the potential carcinogenic risk. And so we know that at least seven types of cancers are associated with drinking alcohol. And so the big question is, well, what are the guidelines right now? Right now, the guidelines currently state that for men, up to 2 drinks of alcoholic beverages per day, and for women, up to 1. Although some studies do talk about that even less than 1 drink per day can actually associate with cancer risk, with increasing your risk. And so when it comes to, for example, red wine, people talk a lot about that. Well, in the past, we've talked about maybe it's good for you. Maybe it's good for your heart. Maybe it can lower cancer risk. In fact, there are studies that show that people in the US do still think that alcohol could be actually lowering cancer risk. But that's another point. In regards to red wine, I like to take it back into what about red wine could actually have some benefit. Resveratrol, it's a big word we use on social media, it's a compound within red wine that has associated anti-inflammatory effects that could potentially lower some risk of chronic diseases. Well, you think about what else has resveratrol. Grapes and berries. Fruits have resveratrol. And so instead of thinking about, well, maybe I should drink a glass of red wine to be healthy, why not just eat some fruits?
Yeah,
and that's what I'd like to refocus the idea.
Well, I've also seen those studies that show that you'd have to consume so much alcohol to get the benefit of the resveratrol,
exactly,
where it's actually anti-aging or good for your health. But then by that point, it's just scratching the health benefit because you're drinking so much alcohol.
Exactly. You nailed it. Yeah.
So when it comes to, you're saying with alcohol, for some people, it could be less than a drink a day, could still lead to cancer. Do you think that has to do with a little bit of the function, like we were talking about how I get Asian glow, right? So I just know I cannot drink alcohol. I'm inevitably going to feel awful instead of feel good. And so I truly don't know the feeling when people are like, oh, I love drinking because it makes me feel good and loosens me up. I'm like, I know, I feel like I'm about to die and pass out. And my face turns red. Do you think that could affect me more if I'm still continuing to push through it and drink and then lead to cancer?
Yes. So taking it a step back, when it comes to Asian glow, basically there are various levels of that because certain Asian populations or some people will have a deficiency in the enzyme that breaks down the alcohol and through the pathways, aldehyde dehydrogenase. And there are 2 different steps in that, not to get too nerdy, but basically there are various levels of that deficiency. And because of that, you can get various reactions similar to kind of like an allergic reaction to something where you get hives, you turn red. I get really bad hives, actually. And so if I ever drink in a party, which I don't typically,
Yeah.
but you'll see me.
We're too pretty.
Well, one, I don't look good in photos, but second is that you'll see me itching in the weirdest places throughout the night. And that's not, of course, a pretty sight and also not comfortable at all. And so when we think about people who have Asian descent, who have this deficiency, and you drink alcohol, there are studies that suggest that there is an increased risk in cancer.
Okay.
Yeah.
I mean, because if it's making you feel awful.
Exactly. And what's interesting is that we don't use it as much today, but there was a medication called disulfiram. Back in the day, we would use it more for people who abuse alcohol. What it would do is it would essentially induce Asian glow, which is it blocks this enzyme and it essentially makes you feel sick.
Yeah.
Therefore, not wanting to drink alcohol.
Yeah. I try to explain this feeling to my friends who are big drinkers because they'll see me just like babysitting a glass of wine the entire night and I won't even finish it. And I'm just like, you don't understand. What you think is like feeling good, I feel the opposite. My heartbeat starts racing. I turn really red. I get so hot that I feel cold, almost like the air feels cold to me and I get uncomfortable. I start shivering and it just does not feel, and then I end up with like a hangover an hour later. So I'm like not in a good place when I'm drinking. Yeah,
same. I don't.
It's not fun.
Yeah.
It's not fun. When it comes to, obviously we know smoking. I mean, I think people have been, beat over the head with the information about how bad smoking is for you just in so many different ways. Yeah. I don't think we need to harp on that one too much. The third one you said though was obesity.
Excessive. Yeah, exactly.
And so when it comes to that, I mean, are you seeing things like Ozempic helping people out now?
Oh, yeah. I mean, that's a big hot topic right now because the whole GLP-1 realm of medications, there are studies that associate with improving cardiovascular outcomes, diabetes, and then now really more delving into the cancer prevention world. And so again, more to come, I think, as these medications are more widely used and more studies are being funded. I'm curious to see how really it will affect this nearly 40% projection for cancer in the US. Okay, so at dinner, we were talking about food. Yeah. I was telling you how I'm on a high protein diet. Like that is what I eat is protein. I feel like I've never thought about protein so much in my life until I became an adult. Yeah. And so one of the things I told you is that I eat red meat a lot. And I immediately got side eye from you. No, I don't. That's hilarious. Okay, I don't shame anyone. And actually, a side note before you continue is that every time I go to a party, especially because I'm a physician, but also because I have a social media platform where I talk about nutrition, people always are eating kind of like looking at me and I'm thinking I might say something. I hope no one ever feels that way because I really don't judge. I don't judge. I'm just joking. So yes, I talk a lot in my social media platform about the idea that red meat has an associated cancer risk. I talk a lot about the Mediterranean diet. I talk a lot about it for a number of reasons. First of all, I think that it's much more sustainable than a lot of diets out there that are more radical, like carnivore diets or pure vegan diets. And I think that just having a little bit more sustainability will help encourage people to sustain that diet and live a healthier life. Secondly, it's the most evidence-based diet out there. Most clinicians will tell you that they would agree with that. So not controversial in that sense. And then also, it's more of a philosophy as opposed to a diet. The philosophy centers around generally more plant-based foods, less red meat, processed meat, ultra-processed foods, alcohol. And so just kind of that philosophy, I think, can bleed into a lot of different parts of people's kind of daily activity. And so that's why I talk a lot about kind of limiting red meat. Now, I'm Filipino from the Philippines, and so we talk a lot about a lot of meat in our diet. We grew up just eating a lot of red meat. And so it was hard for me to really grapple with that growing up and going through medicine and looking into the data because I enjoy it. I really do. But I think that it's really a conscious decision to think about what we put in our bodies, and limiting red meat to occasional intake really does help with cancer risk. What's occasional intake? That's a good question. I don't think it's one size fit all for everyone. But I would say for me personally, I would maybe do once a week, once every other week. Yeah. Just kind of try to, the way I used to think about it when I first started was that, you know what, when I'm looking at a menu in a restaurant, a lot of times I don't truly care if it's chicken, beef, or pork or whatnot, at least for the majority of my upbringing. And then I realized, well, if it doesn't matter truly that much to me in taste, then why not just go with chicken or why not just go with salmon? Yeah. And so that's kind of how I trained myself kind of slowly over time. What is the issue with red meat? Why is it so bad? So there are certain compounds NOCs, PAHs, basically they're nitrous compounds that essentially have this carcinogenic effect, especially when they're in high heat. So we talk about grilling or charring. High heat, when red meat is exposed to it, it releases these compounds that then are pro-inflammatory and increase cancer risk.
So if I'm just eating beef tartare all the time, I'm good. I'm good,
well,
right?
There is still some of those compounds, maybe not as much if it's not exposed to high heat, but...
Is that the same with like the cured meats, for instance, like hot dogs, prosciutto? Like everybody's into the charcuterie boards these days.
I used to love charcuterie boards a lot. And not that I say that I limit it completely, but yes, there is still that pro-carcinogenic effect. I mean, high salt diets also in and of themselves, which of course a lot of preserved foods have. High salt diets have an increase in gastric cancer specifically and other cancers. But yes, preserved foods, ultra-processed foods, processed meats, all of that.
Okay. Have those nitrates or the
they have different compounds, but yes, they have compounds that increase cancer risk.
And are there specific cancers that it leads to? You said gastric, for instance.
Yeah, gastric is one that comes to mind when it comes to high salt diets. Colon cancer. The biggest, we're talking a lot about colon cancer in the last few years because studies have been coming out that people younger than 50, 20s, 30s, 40s are more frequently getting diagnosed with a disease than before. And so that's really scary because we don't truly know. And I'm sorry to say that. I'm a doctor. I know I try to know answers, but really we don't fully know. That's why we talk a lot about the idea of gut health. We talk about microplastics. We talk about different things we're doing to our bodies, eating, moving, etc., to figure out why that is.
I have seen a couple of things that say, like, people have been giving some reasons why they think it's like a theory of why younger people are getting diagnosed more and more with colon cancer.
Yeah.
Is food one of those reasons?
Food is, and it centers around the gut microbiome, which is essentially the microorganisms, bacteria. For example, when you think about probiotics, prebiotics, we think about that realm inside our guts and what we can eat and do that affects it, that then increases inflammation to then be pro-carcinogenic. Yes, a lot of growing evidence on trying to figure out what that is. For example, we think about, and I talk about fiber a lot, because fiber is just so good for the gut, for our gut health and our gut microbiome. For context for people, just in case people don't know, prebiotics, I think of, are like the food for probiotics, which are bacteria. Prebiotics are like your fruits and vegetables, which is fiber. Another word is fiber. And so more fruits and vegetables, nuts, seeds, legumes, these are all rich in fiber. The more we eat of that, then the happier our guts are. And then hopefully, and in theory, a lot of our risk for cancer and other chronic diseases is then lower.
Does this kind of makes me think, does this mean that we should just be pooping more? Is like that? Is that seriously?
That's a good question. Well, there are different types of fiber.
Okay.
And it's soluble and insoluble, and they have different benefits. Just to take a step back, what does fiber help us with? Yes, it helps us being regular with our bowel movements, lowers our cholesterol. It helps control our blood sugar, so less high spikes, for example, lowers the risk of chronic diseases, lowers inflammation, feeds the gut bacteria. So there's so many health benefits associated with fiber. But yes, constipation, no bueno. So definitely fiber helps with that as well. So
besides food, are there other lifestyle factors that contribute to preventing or actually causing cancer?
You're going to nerd out with me about this. But,
I love nerding
sun
out.
Protection.
Yes.
Sun protection. That study I referenced earlier in this conversation did talk about sun protection and sunscreen. So as annoying as it sounds, every 2 hours when you're outside, of course, reapplying SPF, using hats, anything to block the sun, especially when the UV index is high. Those are definitely associated with preventing and lowering the risk of skin cancer. A lot of people.
So not causing skin cancer, or like any kind of cancer, because that's the thing we see all the time is people demonizing, especially the chemical filters, because they're just kind of like, these are causing cancer, and so you shouldn't be using them. Exactly.
A lot of misinformation about sunscreens out there, and I'm here to say my professional and personal opinion is that no. Sunscreen is safe and should be used to prevent skin cancer. Now, I talk through the lens of I work in a cancer center and I work with many different types of cancer, including patients with skin cancer. As annoying as it is for people to put on a hat or apply sunscreen every couple of hours when outside, it is way more annoying to see me in the hospital with that diagnosis, suffering from who knows what medical condition related to it.
Yeah, that makes sense. I saw a dermatologist post the other day, life's too short to be in my office to get a hole punched into your face to remove your cancer or something.
Yeah, it's horrible. And of course, there are different levels of that. Melanoma can be metastatic, for example, so meaning travel to other different parts of the body. And so in those cases, we use a lot of different cancer treatments, systemic treatments, immunotherapy being one of them. And there are side effects associated with them. They can be very effective, but of course, there are always side effects potentially.
Right. What are other lifestyle factors that can prevent cancer?
So we kind of talked about it already. The study I referenced earlier talked about low amounts of fruits and vegetables, living a sedentary lifestyle, ultra-processed foods, processed meat, red meat. And those are, and then of course we talked about the top three: tobacco, alcohol, and excessive weight gain. Yeah,
those are the main factors that can cause cancers.
That essentially are preventable risk factors that we can control that can then lower our overall cancer risk.
Yeah, so if we want to down a whole bowl of blueberries, go for it.
Yeah, I mean, I'm a huge fan. Blueberries, when we talk about superfoods, I mean, that's a charged word and some people don't like that word. I personally love blueberries because of antioxidants and vitamins, etc. But also nuts, tree nuts, almonds, cashews, pecans, or pecans. I don't know how I say pecans. Pecans or pecans? I don't know.
I think it's tomato.
Okay. Well, that and pistachios. I don't know how to say that either, apparently. I've been told this in some of my videos.
Internet.
Yeah, some people are like, oh, you could have said pistachios in a different way.
You know what? You're giving information. They're focusing on the wrong thing.
Yeah, I'm like, my excuse is, okay, I didn't grow up in the US. I lived in the Philippines. I don't know.
Yeah. Well, actually, tell me this. So you were saying how people are like, oh, it's genetic and you can't control it anyway. Is that true, though? Is there any truth in it?
There is truth to genetic predispositions to certain types of cancer. For example, we think about a BRCA gene. So if you have breast cancer, for example, and you have that gene, of course, everyone in your family should get tested, and screening recommendations are different in those instances. So yes, there are genetic predispositions to certain types of cancer.
Okay. What are those cancers that you can be predisposed to?
A lot of them. It's kind of depends. And so colon cancer can have a genetic predisposition, ovarian, breast, honestly, probably almost every type has certain potential genetic predispositions.
But it doesn't mean that you shouldn't try to prevent.
Exactly. Because again, like I've been mentioning, there's a lot of control still that we have in regards to preventable risk factors. With that study, 40%. Yeah.
I'm at that age where my friends are starting to get diagnosed with certain types of cancers, right? Especially breast cancer amongst my friends. When people say like stage 1, stage 2, stage 3, stage 4, does it actually matter what stage you're at?
Oh my goodness, yes. And so the phrase I use a lot is detecting cancer early saves lives. That's why I talk so much about cancer screening, colonoscopies, mammograms, breast ultrasounds. There are different tools that we use to detect cancer early because the earlier you catch it, generally speaking, the much easier to treat. Right? Sometimes you can do a small procedure, surgery, and sometimes you do full chemotherapy, immunotherapy, systemic treatments, you name it, radiation. And so not only are the outcomes much better from a cancer mortality perspective, but also you don't have to go through so many levels of treatment if you catch it early.
Besides the stage that it's at, are there factors that can kind of tell you if a person's going to be able to make it through or not?
So every time, and of course this can depend on the institution, the country, access to healthcare, of course, a big issue. We generally like to profile the like the molecular profiling and genetics that are associated with each cancer diagnosis. Because, and I've talked about this in my platform, about the different types of cancer treatment, and certain types of cancer treatment, like targeted therapy, can target specific mutations if they're present or not present in cancer. So lung cancer, let's say someone gets diagnosed, we run tests through with the tumor cells, and then we see, oh, you know what, you qualify for this specific targeted treatment that targets this specific mutation, and therefore outcomes are better if we just use this drug over conventional chemotherapy, for example.
I've seen this happen to some of my friends' parents and stuff, but you see this in movies too, that they'll be like, you've got 3 months to live, or you've got a whole year. And sometimes I've actually seen that to the T. Like I've seen a friend's parent be diagnosed and they say to her, you've got a year basically. And then almost to the T on that year mark is when they pass. How do you figure that out?
It's all based on studies on prior similar instances with that specific cancer type, similar enough to your case, that then show us, on average, these people live about, 5 years or whatever it may be. And as we progress with research in cancer treatments, we then try to extend that longer and longer. I will like to point out with what you just said, doctors we're not magicians also. And so what can happen sometimes is, let's say I were to say that to someone, say, oh, I think you have a year to live. And let's say they live past that. A lot of times in the hospital, I see this a lot. They'll then go back and say, well, you know what? I don't really trust you as much. You told me I had 1 year to live and now I'm here 2 years.
Yeah.
And so I think that can be a little bit of a tricky conversation to navigate, especially when one physician says it or another. So I would just kind of, for folks at home, think about, take it with a grain of salt. This is only based on prior data. Each person can be different, but this is the best estimated guess, educated guess that we have for a person's situation.
Can people turn that around? You see them, you're like, you've basically got a year to live, but then they change their diet, they start exercising, doing all the things. Yeah. Can it completely turn around that diagnosis?
Yeah, I mean, depending on the cancer type, of course, some are really, really aggressive and some not so much. But yes, it all comes down to a curve, right? A lot of people in a study fall on different parts of that curve. And some people live a lot longer than what we would expect. Yeah. And yes, diet, exercise, living an active lifestyle, lowering the intake of alcohol, smoking, etc., all of that does contribute to overall health. And so patients with cancer also have heart disease, diabetes, and other chronic conditions that then contribute to mortality.
A big conversation that's been coming up a lot is microplastics. Even for me in skincare, we created a product, our cleansing balm, and decided to not include microplastics, even though they can help with the rinse off and make it a better experience for a cleansing balm. We decided not to use them because of the environment and just the not knowing what they can do. But can they also cause cancer?
That's a great question. Another growing body of research. In terms of a cancer-specific risk, the verdict is still out. There's still some studies, preclinical, are suggesting that there is a cancer risk. I wouldn't be surprised that there is. However, there was a study done fairly recently that looked at patients who got carotid endarterectomies, which is essentially a procedure where they strip away the plaque in the carotid artery, which is the large artery by your neck. And they found that microplastics were found in these people's arteries. And there was a risk associated with heart attacks, strokes, and death.
Just because they're clogging.
Yeah, because because the microplastics are lodged in there in the arteries. And so of course, that can affect health outcomes.
How are they getting into the arteries?
That is a good question. And so I talk about in my platform about how do we minimize risk. Of course, microplastics are basically everywhere, right? We can't have zero exposure in the world we currently live in. So what I like to always encourage is anything that has to do with you ingesting something, anything by your mouth, by your face, any way you can lower that exposure, the better. For example, the famous thing I talk a lot about is takeout food.
Right.
It's hard to, of course, I live in New York City and it's very hard to not get takeout food. But every time I get any soup or any warm food of any type that comes in a vessel that is in plastic, a one-time use plastic container, I instantly, just as simple as it is, just change the vessel, just pour it into a bowl, a microwave safe container and eat it instantly when I get it from takeout. The longer that microplastics are exposed to heat, the more that the microplastic can leach into the liquid or food, and then you then ingest it.
Right. So you're at least like, maybe it was already exposed a little bit, but you're at least limiting the amount of time that it's being exposed.
Exactly. And of course, ideally not getting takeout and not even having any exposure to said material. Yeah. But that's one way.
Well, I mean, I know for a fact, I've seen people take that, like if they ordered a soup and maybe it arrived and it's not as warm anymore, they'll put that vessel right into the microwave.
Ooh, yeah.
And then they'll heat it up in that plastic.
Exactly. And another thing is that another common thing I see is people have these plastic containers. They reuse the takeout containers.
Right.
Makes sense because you don't want to waste. Being conscious. You don't want to waste plastic. And then you put it in the dishwasher, and then you run your dishwasher, and depending on the type, heat emanates from the bottom part of the dishwasher. So I always tell people, of course, try to avoid microplastic. But let's say you're using it for whatever reason, always put plastic in the top rack of your dishwasher so that there's less heat exposure.
Right.
Yeah.
Oh, could that be like just affecting all of your dishes by being in the dishwasher?
Exactly. In theory,
oh God, I hadn't even thought about that. Yeah. Because I moved my plastic stuff to the top, but I always thought maybe that piece of plastic, the reason I'm moving it up to the top is so that it doesn't like like melt and like
some
bleed microplastics, I guess, so that when I'm using it, this is my like the way I was thinking of it, but I wasn't thinking about it like spreading the microplastics.
It could. I think that's one potential mechanism. So I try to honestly avoid any microplastic use or plastic use in dishwashers.
Noted.
Yeah.
Noted. Okay. Are there any of these types of things like that are environmental that we expose ourselves to that we can totally prevent, like the microplastics, that you think people should know about too? Even if it's still just a growing body of evidence that we're seeing around it.
Or anything else in the environment.
Yeah.
So forever chemicals.
Okay.
It's a buzzword. We talk about it on social media as well. But forever chemicals are essentially chemicals that, as the name implies, live for a very long time. And so there is evidence, even clinical human studies, that suggest that there is an increased risk with certain types of cancers. So kidney, liver, testicular, those are the types of cancers essentially associated. So how do we get exposed to forever chemicals? The classic thing I talk about is pans, the pans we use to cook.
Okay.
I use non-toxic cookware.
Okay.
To try to avoid any exposure with my food on top of a pan and heat.
Right.
Similar to kind of microplastics, heat just kind of brings things about and causes exposure. And so, I use non-toxic cookware every time I cook. I also don't use those black plastic spatulas and stuff. Yeah, I use wood or non-toxic utensils as well, because all of that, again, exposed to heat can expose you to certain chemicals.
So the black plastic, like in spatulas, that truly is a thing. Because I've seen this on social media, but then sometimes you're like, should I trust this? Is this just fear mongering? Yeah.
So I actually posted about this because there was a study that was done that looked into black plastics specifically, and they found that essentially there were certain compounds that were, recycled from prior TVs and other types of plastic.
Oh,
yeah, exactly. And then exposing you to, of course, certain chemicals and plastics. And so
what are forever chemicals? Like, are there other ones besides this like black plastic?
Yeah. So, the black plastic has some. So another exposure is actually floss. There's certain flosses that I get. There's one, this is not sponsored, Dr. Tongues, I think it's called.
That's the one I use. I use Dr.
Exactly.
Tongues.
Great. Because it doesn't have certain compounds in it. Again, anything that has to do with my mouth, like, or ingestion. Because I say this because a lot of people freak out about clothing, yoga pants,
right,
certain jackets
coming from China. That's what I always hear. Like, if I buy something from Amazon and I post that I got it from Amazon, that's one of the first comments I'll get is that you're being exposed to chemicals.
Yeah, so depending on the certain clothing type, there are exactly forever chemicals in them. And by the way, for folks at home, PFOS, PFOS, and PFAS, PFAS, those are the acronyms we use for these forever chemicals.
Okay.
Don't ask me how to recite them out. It's a long word off the top of my head. But yes, certain clothes can have it. And so underwear is a common one. And in those instances, this is my personal opinion, it's hard to avoid all of it, right? We're touching things on a daily basis. So that's why I really focus so much on what we eat and anything that goes in our mouth, like floss, to help lower that exposure.
Okay, so that's like the easiest way. Okay. Yeah. If we get clothing that has these forever chemicals in it, can we just wash them?
Well, ideally you wouldn't get said clothing, but yes, I don't know how else we would. I don't think we can just walk around with clothes that we never wash.
Well, obviously, but like I'm saying, can we just wash them to just get the chemicals
to get rid
out?
Of, no, unfortunately, it doesn't work like that. Okay. Yeah, sorry, I misunderstood you.
I wash my clothing, Dr. Tim.
I shower every day. I don't know about you, Susan, but
what are some of the other common things that you wish people would know about cancer prevention or what's causing?
I think one of the most common things I hear is people will share anecdotal things. For example, they'll say, my ex-brother-in-law had cancer and he decided to take insert X supplement and stop all cancer treatment, which were in theory prescribed from the oncologist. And then somehow they were cured.
I do see this a lot. Yeah.
People talk a lot about that, very anecdotal. And anecdotal is important because whenever we talk about standardizing treatment for people, they're based on large studies. They're based on human studies and also a lot of trial and error and figuring out with different phases of clinical trials. When someone has a specific situation we don't know anything about, let's say, for example, some cancers aren't that lethal.
Yeah.
Sometimes you can just live with that cancer and it can just be kind of lying dormant and you don't have to deal with it. Depending on your life expectancy, how old you are, etc. Sometimes we don't treat certain cancers. And so we don't know that specific situation. And then people use that to then go and comment on certain social media posts, whether mine or other health creators, and use that as quote unquote evidence to support why you shouldn't, I don't know, get chemotherapy.
Right.
And so that's very harmful. It's very, very harmful because you don't know who's reading each and every comment.
Right.
And people could be changing their behaviors based on social media and then without valid information. And then, of course, there are poor health outcomes that can be associated.
Yeah. That makes sense. Yeah. Anecdotes are fun, and maybe they did pertain to that person, but it doesn't mean that it pertains to everybody.
Exactly.
Are there any kind of supplements? Like, for instance, I started using colostrum just because I think it's fun. Like,
fun.
Not because I need it, because I like it. I like the concept behind it. Okay. Do you think that can be preventative? It's like a pre and probiotic in some ways.
Oh man, this is a very big topic, and I have varying opinions depending on the supplement.
Okay.
Of course, if someone is deficient in something, let's say they have a diagnosis of, you know what, I checked your labs and you are deficient in magnesium, therefore you should take magnesium, then I think, of course, the certain supplements can be helpful in that setting. Same with vitamin D, or, vitamin D is actually a little bit, has been controversial in the medical world in terms of supplementing. But for this purposes, let's say, it has been kind of up and down in terms of literature. But yes, overall, generally speaking, there are benefits to calcium vitamin D, especially for older women. And so, yes, when there are diagnosed deficiencies, supplements can be very helpful. On the other hand, the supplement industry, as we know, booming with money, and people will sell you anything. And so it's hard for people, especially for people from underserved backgrounds, to kind of discern and look through all the noise of misinformation online and see what is truly beneficial. And I say this coming from a very underserved background. I came from the Philippines. Immigrated as a kid, had very humble beginnings. And so a lot of the reason why I'm on social media is to even the playing field for access to good health information. And supplements is exactly in this realm of people who are trying to sell people things and then claiming random health claims that really don't have any evidence backing it. Like,
I'm one of those people. I love wellness. So I'm like getting all my labs drawn all the time. I check my hormone levels, all of it. I do all the things. Are there signs that can point to you being like prone to cancer if you're low in something?
That is a good question. Sometimes it can be kind of, it takes an astute clinician to kind of read between the lines. For example, if someone gets blood work and they're, always deficient in various vitamins and electrolytes, we call them. Like, for example, iron, anemia. Iron deficiency anemia is a very common issue.
Oh, interesting.
Women, for example, who menstruate, of course, can bleed, and that can potentially lead to iron deficiency. And when we think about iron deficiency anemia chronically for, let's say, a person who isn't menstruating or a person who doesn't have any reason to have a deficiency in iron, we have to really start thinking about colon cancer, for example, being a potential issue, because bleeding and microscopic bleeding, you might not even be able to see it, and not to be fear mongering or anything like that. But it's one potential sign that you should, think about a colonoscopy, or at least talking to a doctor about it.
That is good to know. Are there other little tidbits like that where people should be like just considering this, not to fearmonger them, but just like little things that are signs or something that maybe they should just go get checked? Because I know people will they just don't want to go to the doctor ever.
Well, first of all, listen to your body. You know yourself better than anyone can. And oftentimes we like to rationalize. We like to say, you know what, it's just a small thing. I'm too busy. I have to go to work, etc. I'll put that into next month. And it becomes next month, and then it becomes next year. And lo and behold, you realize that you've been constipated for much longer than other people would normally be. You're losing weight without necessarily wanting to lose weight, and you're tired kind of all the time, and you didn't really quite put your finger on it why you feel that way. And so, of course, these can overlap with a lot of medical conditions. Depression, for example, can of course present in some of these ways. But that's a sign to really talk to your doctor, see a health provider, talk and see maybe there is something that we need to look into. Maybe it's labs that need to be drawn, or a colonoscopy to screen. And by the way, the difference between diagnostic workup and screening, people need to know that. Screening is you don't have any symptoms and you are I don't know, you're 40 and we want to give you a mammogram to assess for breast cancer. Or, hey, I feel a lump in my breast. I have symptoms. This is a diagnostic workup, meaning you don't have to wait till you're 40 to get a mammogram.
Right.
You can get it earlier or an ultrasound or something like that to assess why you're having a certain symptom. Same thing for colonoscopies. You see blood in your stool and it's not due to commonly something like hemorrhoids, which is a very common issue that people face that causes bleeding in stool. Then maybe a colonoscopy would be something warranted.
Well, Dr. Tim, this is so enlightening. I could talk to you for hours and hours like I did at dinner.
No, I'm so glad that we got to connect. This is so fun.
Yeah, so much fun. And, where can everyone find you?
You can find me drtim.md, TikTok, Instagram, YouTube, etc. I have a website as well.
You sent me an ebook also.
Oh, yes, I did. A Mediterranean diet. I talk a lot about it, again, for cancer prevention, chronic disease prevention.
All right. Well, thank you so much. Loved having you on the podcast.
Thank you.
Thanks for tuning into this episode of Glowlab. If you enjoyed the show, make sure you follow, rate, and also share it with a friend because we want to keep this show going. I'll talk to you next time.